It's now known that between 5 and 22% of all colorectal carcinomas develop as locally advanced tumors. A number of clinical studies demonstrate the irrefutable fact that T4 stage is an important and independent factor associated with the prognosis of the colorectal cancer patients. Locally advanced tumors are a surgical challenge due to the clinical presumption of tumor involvement in other structures and organs. The estimated need for extensive surgical resection, often with multivisceral and block resection, is crucial for preoperative planning. Long-term postoperative survival is achievable, but only after performing a complete R0 resection. We've been encouraged to do that study by the fact that the disease progression in patients with locally advanced tumors is not determined only by local tumor characteristics, but also by the system of immune and inflammatory response of the body. We performed an analysis of some histopathological and inflammatory markers in 103 patients with proven colorectal cancer. As each know, the chronic inflammation is associated with several solid cancers. It is interesting how the levels of inflammatory markers in the volumetric growth of the tumor and the progressive involvement of the surrounding tissues are changing. There is much evidence that the local and systemic inflammatory response plays an important role in the progression of a variety of tumor types. One of the markers is CRP, C-reactive protein. It's a marker of general inflammation, one of the acute phase proteins, which are a component of the innate immune response, which increases after infection, trauma, burns, and tumors. We've applied the Glasgow prognostic score based on the increase in the concentration of CRP and the hypoalbuminemia, which was independently associated with a worse outcome in patients with colorectal cancer. When we investigated the distribution of the values of the CRP among the groups with early locally advanced and recurrent colorectal cancer, we found that in most of the cases of locally advanced cancer, the level of the CRP was increased. The statistic log-rank test also showed that there is a statistically significant difference in the survival between the groups of normal, twice and more than twice increased level of the CRP. This proves CRP is a prognostic factor for overall survival. Another finding is there is strong evidence that the presence of pronounced lymphocytic infiltration in and around the tumor in localized colorectal tumors observed by hematoxylin eosin standard staining is associated with improved survival. We have used the modified Just-Clintrop score system to evaluate the grade of that lymphocytic infiltration in our patients. The data from the study of 48 patients with histologically confirmed locally advanced tumors. It showed significantly increased survival in higher score, indicating a more pronounced infiltration of the tumor edge by the inflammatory cells of the local immune system. This explains the importance of the imperative requirement for obtaining a sufficient number and volume of microbiopsy taken from the tumor tissue closest to the tumor edge in the preoperative period and defining the relevant Just-Clintrop score. It will be helpful when choosing an aggressive approach for locally advanced tumors by performing a multivisceral resections. Other prognostic system we have used is Petersen prognostic index in patients with locally advanced tumors in stage 2B and 3B and C. And that score system includes peritoneal involvement, tumor invasion of the resection margins, transversal circumferential, venous invasion, tumor perforation, and perineural invasion. The Petersen index selected T4 patients without positive lymph nodes at high risk of tumor recurrence, which is similarly with T4 tumors with positive lymph nodes. These histopathological and inflammatory markers could be helpful in the validation of the strategy for management of patients with locally advanced colorectal cancer and the detection of clear criteria for resectability of those tumors, which is imperative in the surgical treatment.